Hi, and thanks for visiting the Hearing Clinic UK. Just now I'm going to talk you through our full hearing assessment. We do advise for any patients coming in to have their hearing thoroughly assessed to attend the clinic 5 to 10 minutes before your booked appointment. A specialist will come out and meet you in the reception area and bring you through to our treatment rooms. They will go through the medical questionnaire with you, and we would advise, if at all possible, for you to bring along a copy of any medication that you're currently taking. Your specialist will take a case history with you and inquire about your areas of difficulty in quite a bit more detail. Shortly after this, your specialist will use a high definition video camera to check the condition of your outer ears, and in an ideal scenario should be able to look all the way down to your eardrums and ascertain the condition of them. If it is safe to do so at that point, they will advise you to come over into a sound booth. We will use a calibrated audiometer and we will assess your hearing levels thoroughly. Our assessment goes far deeper than many others out there. We will take a look at your speech discrimination ability in each individual ear. 2 of these assessments we will do up front. The first one is what was known as a PB maximum assessment. This will inform your specialist what the maximum speech discrimination ability is in either ear. Secondary to that, they will take a speech recognition threshold test, which will ascertain how well your hearing system operates at softer volume levels. Next, we will do an ear conduction assessment, which will measure a wide range of tones on both sides, from very low frequencies through the middle ones and up into the higher pitches. We're looking for the very softest that each ear can hear. Beyond that, we then take a second assessment, which is known as a bone conduction test. This will present the sound through the skull as a bone vibration and send the signal into the inner ear, which is where the auditory nerve comes down to, and the vibrations coming through the hearing system are processed onto the nerves. This will medically diagnose which part of the hearing system is causing difficulty. Beyond that, we will take a ULL test, which is an uncomfortable loudness level assessment. This will give the specialist all the information they need to know about your dynamic range, from the softest sounds you can hear through to the loudest sounds that you feel comfortable with. Finally, they will move you back out of the sound booth and will run through a series of assessments based upon speech perception unaided versus speech perception aided. If you have particular difficulty hearing in a background noise environment, we don't stop there. We also have a familiar voice word recognition test. As a lot of the systems that we use calibrated speech, we actually prefer to go a stage further and have a look at a very personalised speech discrimination score. Ideally, it would be somebody close to you would come along at the assessment. We can test how well you're hearing and perceiving their voice in an unaided manner. And we can also then move on and see how you perform with amplification aiding your ears. Most importantly, after all of these results have been taken, your specialist will go through your hearing assessment results thoroughly. We'll be able to identify with you which part of your ears are causing the trouble and exactly by how much. We can talk you through the solutions and the treatment options that are going to best suit your hearing difficulties. In the instance that your hearing requires medical referral for further treatment or exploration, we'll write a report and we'll pass it over to either your GP or on to an ear, nose and throat specialist as is required. Once you've had the opportunity to assess the improvement that the amplification will offer you, your specialist will go through our extensive list of hearing devices and help you pick and choose the most appropriate one to suit both your hearing needs, your lifestyle and also your budget. After selecting the ideal devices that will match your hearing needs, your lifestyle and also what budget you want to work within, your specialist will place an order. Different devices take a different amount of time to have ready. Some will be ready within a few days, others which are more customised to the patient may take up to 2 weeks to be ready. We'll have them delivered to the clinic where we'll bring you in and we'll go through our thorough fitting process.